Heart attacks are one of the leading causes of death in the United States. A heart attack is a situation where the heart has blockage build up over time, this fatty plaque buildup. There's a skin on the outside of that fatty plaque buildup, and sometimes it can crack or fissure, and then your body sends platelets, which are like cork-like substances that try to seal that plaque. But sometimes the clot, the sealing, gets too aggressive and there's a complete blockage of blood flow. Well, if that blood flow is completely blocked, then the part of the heart that's fed by that blood flow dies. It turns black and dies. And if that part of the heart includes the electrical system that's responsible for the pumping of the blood, if that pumping starts to just be a fibrillation instead of the blood pumping, it's just stagnant, then our body doesn't get enough blood flow. The brain doesn't get enough blood flow and the person will simply pass out. If someone comes across that person, starts CPR, that starts the blood pumping back again, but it may still be fibrillating, so that's where somebody has to be shocked to get their heart pumping in the normal way. This fatty plaque buildup does not have to happen. Keeping blood pressure under control, high blood pressure can cause those cracks and fissures to happen more readily. Smoking, unfortunately, irritates the lining of the arteries and makes this fatty plaque buildup more likely. It does run in certain families for cholesterol to be high, so people who have high cholesterol should be on cholesterol-lowering medicines. Those medicines not only reduce the amount of cholesterol that's floating around in the blood, but they also cause the fatty plaque to be more stable, less likely to have those cracks and fissures. Smoking, of course, unfortunately, when you smoke cigarettes, it irritates the lining of the arteries, causing that fatty plaque to build up more readily. If you exercise, then your heart arteries are just more robust. You have better blood flow to your heart so that if you do get a blockage, you've got other arteries that can provide blood flow. So eating right to help lower the cholesterol and prevent this blockage, not smoking or quitting smoking if you do, keeping blood pressure and cholesterol under control, and exercising can help prevent death from heart attacks. That's A Minute for Health.